How can you help a child who has a mentally ill family member? Talking about someone who has a mother or a father who's mentally ill, or maybe a sibling in the family, and the whole family dynamic is based on trying to manage this mentally ill sibling. Well, first of all, tell them age-appropriate truth about the illness. It is often scary to tell your child that, you know, mom or dad has bipolar disorder, or mom or dad has serious depression. But the child needs to know, because the child has noticed the behavior and they've noticed it's not right, and they've worried about it, and they've looked at it, and they've maybe even felt responsible for the behavior because maybe they thought, I make mommy sad, or I make daddy upset, or I make it too difficult for daddy. That's why he's always irritable with me. So when you tell the child age-appropriate truth and you give this thing a label, you actually help the child to understand it and to feel less responsible for it, and to make more sense of what could be a different, dysfunctional, abnormal, or chaotic world. You want to allow them to express their feelings, ask questions, and participate in the family decisions when appropriate. So it might be, how can we as a family do better with this particular problem? Or how can we all get to a place where we can get everything done when there are times that mom isn't able to, or when mom is focused on having to take brother to all these places, or be away with brother for a while. So when you have a family discussion, you sit down, talk about the problem, you get everybody's input, and you figure out how to solve it. This is good for children. This is good even for adult children, because it gives them a sense of having some power and control over what would otherwise be a situation that seems out of control. You want to try to make the family as normal as possible. Try to make the family function as much like they would had the person not be mentally ill, and work really hard at trying not to neglect the child's basic needs. This may require getting someone from the outside to come in and take the child to activities, maybe a teenager or an older family member, or someone that you can have that person come in and help with homework, or maybe it means having an outside housekeeper come in twice a week if you can afford it. Anything that you can do to keep the family functioning normal in an attempt not to neglect the child's needs is very important. You want to teach them coping skills for the difficulties they're experiencing. I teach 10 life-saving principles, or I sometimes call them 10 relationship-changing principles, for people who deal with all difficult relationships. And what I would say is that you can teach all of those to your children. You can teach your children not to obsess on the person who's mentally ill, to not feel responsible, to detach and not take the mood changes and the feelings of that person personal, to not feel like it's your fault that mom's sad. You can teach them how to detach and live their own lives, and how to feel good about themselves, how to do loving things for that person but not feel responsible for that person, how to take care of themselves, that it's okay to take care of themselves, that that's not selfish, that it's okay to talk about your fears, it's okay to get help, to go to somebody and say, this is what I'm afraid of, help me understand. Help the kids to face their fears and walk through their fears. Help them to speak the truth in love, to know how to speak what's going on in their heart, and validate them. Make sure that when they speak, that you validate their concerns, that you validate their feelings, their perceptions, their experiences in this home, even if it doesn't seem like that's the way it is for you, or that's the way the child should be experiencing it. You're not, the child is. Listen, validate, help the child to know that yes, that is really going on. Then you want to help them to set boundaries. There's times that they can say no. Say no to the person who is asking things of them or treating them a certain way. So help them to set boundaries and to control their own lives with boundaries and taking responsibility for their own stuff. So there's so many coping skills you can teach them. Assure them that they did not cause the person to be ill, and that they have not caused the problems in the family. You want to encourage them to have fun, be happy, laugh, be as much of a child as is possible in the midst of this family crisis and this family difficulty. So give them as much of a childhood. Maybe you want to engage grandma and grandpa to take the kids out to extra fun things, or you want to have a teenager take them out, a responsible teenager or an older cousin who can take them out and make sure that life is good for them. Take them to a support group so they have a safe place to talk and they can hear that they're not alone. They're not the only ones who have a mentally ill family member, and where they can talk openly and share their concerns and their struggles and their frustrations and all of their problems. Support groups are wonderful. They help encourage you and they give you options and ideas about how to handle things. And the most important thing is they make you feel like you're not crazy, that other people are doing this too, and if they can do it, so can you. Bring them to counseling if they need it in order to manage the situation or their feelings, or if they're becoming deeply affected by it to a point where it's becoming a problem. Counseling is always a helpful thing, and you need to not only consider counseling for your family member that's mentally ill, but also for the other families that are dealing with the person who's mentally ill. So I hope that this has helped you think about some things you can do to help the children of a mentally ill parent, should those children be within your sphere of influence and somebody that you can make an impact with. And maybe you're a caregiver in a church, a youth group leader, just a concerned friend. What about maybe a concerned grandparent or parent or sibling? This should hopefully give you some good ideas. So thank you for watching this video on Change My Relationship.